This is Dr. Jazayeri. I'd like to present a case of a 70-year-old gentleman with bilateral osteoarthritis with severe deformity of both shoulders. This is a challenging case in which I'd like to use patient-specific instrumentation in order to allow precise placement of the implant. This is best done by using preoperative planning. We use not just x-rays, but also CT planning in order to determine the version and inclination of the joint, as well as precise positioning of our implants. In this case, with the severe deformity, we have decided to use a patient-specific instrumentation, which will allow us not to only plan the case preoperatively, but allow us to execute the plan during surgery with a specific guide manufactured for each unique patient. In addition, in order to have a comprehensive approach to the patient's overall outcome, I routinely recommend perioperative nutritional supplementation, in which patients are nutritionally optimized starting a week prior to surgery with amino acid supplementation, along with carbohydrate loading prior to surgical event. And the amino acid supplementation is started immediately in the recovery room and followed for generally 2, sometimes longer, 6 weeks after surgery. Here you can see the three-dimensional printed model that will allow us to better understand the anatomy during the course of surgery. I use a standard deltopectoral approach, do a biceps tenodesis. In this case, we've done a subscapular tendon release. Here I'm removing the osteophytes and use a jig to perform the humeral head cut. Once the humeral head cut is removed, we protect the head and access the glenoid. Here you can see positioning of the patient-specific instrumentation. This really gives us a good feel for the patient's anatomy. Additionally, the guide wires here allow us to place the patient-specific instrumentation guide exactly where we had planned it, allowing us to precisely execute the plan. Additionally, I really like the anti-rotational peg. This allows for easy insertion of the implant. Next, we provide compression screw. One is done centrally. I use traditionally 2, sometimes 3 in this case, peripheral screws that give us solid fixation of the glenoid base plate. Here you see impaction of the glenosphere. We next turn our attention to standard humeral preparation, where we do our reaming and broaching. This is a press fit implant. Use a Calcar reamer to remove any additional unnecessary bone around the implant. We generally trial to make sure we're happy with the fixation and the tensioning. This is the ultimate implant going in, again with a press fit technique. The polyethylene is next placed, and we always check good stability and range of motion. I ensure an impingement-free range of motion with good tension throughout both internal and external rotation. Here we have our patient in the PACU. As opposed to just apple juice and crackers, I like to start amino acid supplementation as soon as the patient can tolerate it. Here you can see our post-op x-rays, as well as the patient's range of motion post-operatively. He is 6 weeks from his left shoulder and 4.5 months from his right. Thank you for your attention. I hope you found this educational video valuable.